Welcome back to Dr. Nancy. We continue to follow the big developments in health care reform on Capitol Hill. This morning, House Speaker Nancy Pelosi revealed that the Democrats' bill will include a public option, though not as robust as the one that she had counted on. This bill costs about $894 billion, paid for in part by a tax on millionaire couples. It expands eligibility for Medicaid. Joining me now, Republican Congressman Mike Pence from my home state of Indiana. He's the House GOP Conference Chairman. And Congressman, your reaction to this morning's events?
Well, Nancy, thanks for having me on. I think it's a disappointment, really, to millions of Americans who saw a 1,000-page bill this summer, spent most of the month of August making it clear to members of Congress in both parties that they didn't want government-run insurance. They didn't want a vast new bureaucracy with mandates and taxes that would lead to a government takeover of health care. And now, after weeks of backroom negotiations, now the Pelosi health care bill is revealed this morning, and it's a freight train of higher taxes, mandates, and bureaucracy that instead of being 1,000 pages is 1,990 pages, and actually includes the mandatory word "shall" in the bill 3,425 times. I think the American people want health care reform that lowers costs and not health care reform that just grows government.
Congressman, at the same time that you and I are talking about what Nancy Pelosi has done, the president just finished talking to small businesses about sort of getting the monkey off their back so they can still be innovative and move forward and not be saddled. But I think I always come back to one simple question. For the average hardworking American who works, pays taxes, plays by the rules, why can't he or she just have the basic plan that you guys get in Congress?
Right. Well, in fact, members of Congress do have the ability to choose, Nancy, between a series of private health insurance plans, and we essentially buy health insurance on a nationwide basis.
But you get it inexpensively. You get a good deal.
Well, we get to, like all the 10 million federal employees, members of Congress and their families can participate in what's called the Federal Employee Health Benefits Plan. It allows a massive risk pool on a nationwide basis, and frankly, it is affordable because of that. We ought to let every American purchase health insurance across state lines. We ought to bring about the kind of innovations at a lower cost.
But Congressman, if that's a federal plan and it works and you seem perfectly happy with it, why can't you create something like that or let the average American buy into your plan? I don't understand why there's a firewall around what you have versus what the average American might want.
Well, it's a fair question. There, of course, is no public option in the Federal Employee Health Benefits Plan, and it's not a government-run insurance plan. You just simply get the ability to choose between private health insurance plans, and it allows people to choose among, I think it's 10 plans, and you can decide what's in the best interest of your family.
But let me stop you there, though. Let me stop you right there, Congressman. You get a choice with 10 plans. There are some states that have 2 or 3. It's a virtual monopoly, so perhaps that's a place where there could be common ground, just giving people more choice.
Well, I think, I really think you're right about that, Nancy. I actually think we shouldn't just give people a choice to 10 plans. I think there's 1,300 health insurance companies in the country today. I mean, why the American people can't buy health insurance plans the way they buy car insurance, I think is beyond most of my constituents back in Indiana. And, simply opening up, the president's talked about competition from the very beginning here. And I do think, and Republicans think, that competition is the answer to lower the cost of health insurance and ultimately lower the cost of health care for working families and small businesses. But what we see in the Pelosi health care bill with 1,990 pages of bureaucracy and taxes and mandates is really government-run insurance that we believe will lead to a government takeover of health care in the end.
Well, if there's a government takeover, we'd like what you have.
Well, remember that the Federal Employee Health Benefits Plan does not have the so-called public option. It operates within the private sector plan, and I really believe, Nancy, that we ought to allow Americans to purchase health insurance the way members of Congress do across state lines on a nationwide basis. Add into that medical malpractice reform, which you as a physician know a lot more about than me, and I think you got a real prescription for consensus, for lowering the cost of health insurance and lowering the cost of health care. We don't need this freight train of a new government-run insurance plan. It's not what the American people want, and Republicans are going to be opposing it strenuously.
Representative Mike Pence from Indiana. Thank you, sir.
Thank you.